I will fight. I will fight for you. I always do until my heart.
Hi, I'm Theresa Harmon, co-founder and executive director of To the Moon and Back.
Meghan, I lead Together Through NAS, which was founded in February 2018 by a group of 5 very committed volunteers.
Hi, I'm Lauren Landgren. I am the co-chair of the S.E.N.S E committee, which is the Substance Exposed Newborn Southeast. I co-chair with Rachel Davis, who is the Community Benefits Manager for South Coast Hospital Groups.
To the Moon and Back started back in 2017 as a support group for caregivers, primarily children that had neonatal abstinence syndrome. So we started our support groups, which we meet twice a month at the Plymouth Recovery Center. And then in April of 2018, we got our nonprofit status so that we could kind of build on what we had already started with the support groups and added a number of services to support families. And so services are available for any family constellation, and the only piece that is available just for caregivers, which includes foster, adoptive, and relative caregivers, is our caregiver support group.
I spent the first couple months researching different community members to learn more about NAS and learn about others who had experienced NAS with a baby. I soon realized that there was a gap in education, and I wanted to help.
So the S.E.N.S E committee started in 2015. So the S.E.N.S E committee is made up of providers from various agencies. Over time it's evolved. It was initially called the S.E.N.E committee, Substance Exposed Newborns, and it evolved to become S.E.N.S E. We work together with different providers in the area, and we talk about the needs that we're seeing for children born substance exposed and their families, and what resources each agency can provide. So we created this communication channel for providers to share how we can meet the needs that each agency is facing.
The services that we have currently through To the Moon and Back, it includes a kids group that meets quarterly, that shows kids and their families different interventions based on what we know are some of the long-term needs of children. Being able to talk about the different long-term needs that we see for kids, and the data is still not there yet, and you know, we're still trying to kind of wrap our heads around what we're going to see in the future. But from our children, so what we are seeing are vision and hearing problems. We're seeing fine and gross motor delays. We're seeing things reported as behavioral problems, which are really trouble with sensory integration. And it's also being reported as cognitive difficulties, and those cognitive difficulties are related to executive functioning. So trouble with transition, rigidity in how kids think. So we've done things like yoga and mindfulness. We've done karate, we've done sensory play. So we have those supports for kids and families. We have a resource guide, which we've already distributed about 400 copies throughout the South Shore, and it covers all South Shore resources that our families have recommended.
Theresa was one of the people that I met when I first started interviewing people in the community to understand. And Theresa is such a phenomenal member of the community. She's so open about her experiences and what she's found. I learned so much from her. After a short period of time, I realized that I wanted to do something more formal to support the cause, and Theresa was all in, so she joined our board, as well as 4 other folks that were passionate about the cause as well. So we started in February 2018, and by May we were delivering boxes. This is the Nurture a Superhero box. These are the boxes that go to the hospitals and the community programs on behalf of Together Through NAS, and they're distributed out by the doctors or nurses when the baby goes to leave the hospital. But really, when they hand over the box, the idea is to talk about each item in the box and why it's relevant to an NAS baby. So let me show you what's in the box. It has diaper cream, soothing lotion, Dr. Brown's bottles, we have pacifiers, some handy Badger baby balm, colic drops. At the bottom here we have a swaddle. Actually it's a Woombi because we found that they're the ones that really are easy to tighten up and get on the babies. We also keep a journal in the box. We keep a resource guide, which with To the Moon and Back's help, we would like to tailor for different regions, so each community knows what local resources they have.
We initially started with a few focus groups to identify the needs in the area. The focus groups were held at DCF, at my early intervention program, at WIC, and also with a few MAT providers at their Moms in Recovery groups. So based on the needs that were assessed, we launched a few programs. We created a resource guide that was for the Fall River area.
So we also have a children's grant that just launched last month, and that is for uncovered expenses related to kids exposure that families can apply for. Families have applied for things like tutoring, weighted blankets, nutritional supplements, therapy co-pays, and things like that. And then we have this conference, which we're really excited about. We're excited to get the information about different things that can help kids long-term and tangible resources into the hands of the people that need it, the families that are taking care of children, and the frontline providers like pediatricians, early intervention, and therapy providers, early childhood educators, so to get that information into the hands of the people that need it most.
Naomi, Sheila, and I are very excited for the merger with To the Moon and Back. We see huge synergies. There's the administrative aspect, of course. We won't need to maintain 2 websites, and we won't need to do financials for all. So we get to cut that out and really focus on the project that we're working on the Nurture a Superhero care packages.
We created accordion folders that were donated by Tom Dunce. They were pre-tabbed and given to families to help them organize information that might be helpful for them later on after the child's born. Things like medical records, prenatal history, things that the Department of Children and Family would potentially look for to help with their investigation, and also to support the ongoing care of the baby after the baby was born.
To the Moon and Back is really excited to merge with these other existing agencies that are already doing this work. S.E.N.S.E has been doing this work long before we were.
The providers that are currently on the S.E.N.S.E committee are all from the Fall River, New Bedford area, so we would love to expand our reach throughout Massachusetts to work with providers across the state. Being partnered with To the Moon and Back, we have been able to start expanding that way, working with the Plymouth County District Attorney's Office and really getting that global support.
Ideally, sometime in the near future, with To the Moon and Back's help, we'll make sure that every baby born with NAS goes home with one of these boxes.
To the Moon and Back, when we started in 2017, we served about 20 families. We're now up to serving about 65 families just on the South Shore. So we're really excited to spread our message, spread our programs to the other areas of the state. Moving forward, we would love to be involved in providing statewide service coordination for children with neonatal abstinence syndrome, similar to what Mass FASD has in place, or what kids that are diagnosed with autism have, to make sure that they get what they need and that they're followed and that they're linked to services that are going to help them not only do well, but to meet their full potential, which is so important.
I will fight for you. I always do, until my heart is black and blue.